KP is a 22-year-old Caucasian male who is admitted for chemotherapy for testicular cancer. He has stage 4 testicular cancer with mets to the brain, lungs, liver, and retroperitoneum. He was diagnosed in 2008 after a fall while he was hunting. He walked to the local emergency room where they did an x-ray and found that he had cancer. Currently, he's undergoing his second cycle of BEP chemotherapy. His intake, during assessment, he said that his intake over the past month has declined because of nausea and vomiting. Today's his first day of this round of chemo. He said that he's doing well. He says a lot of people tend to struggle with the first day of chemo, but for him, he struggles with the second day, so he expects to feel much worse tomorrow. He dislikes oral nutrition supplements. He's tried them in the past, and he declined to receive any. Instead, he ordered 2 lunches. He is trying to get in as many calories today as he can. So he ordered 2 trays. During the assessment, he was eating a grilled cheese. He had fries, soup, pudding, soda, and he also had a cheeseburger. He slept through breakfast, but given his intake for the past 1 to 3 months and his decline in weight, he does meet the qualifications for a diagnosis of malnutrition. He doesn't appear overtly malnourished at this time, but given his intake and his rapid decline, he does meet the qualifications. His current inpatient diet order is general. He's able to feed himself and has no oral mucositis and no problems with chewing or swallowing. He does appear thin. He's lost a significant amount of weight, but again doesn't appear overtly malnourished. His skin is within normal limits, but he's declining skin assessments. There's no edema, no chewing or swallowing difficulties. So his current weight is 142, which is the same as his admission weight. His ideal body weight is 172. A month before this, he was 153, and 2 months before this, he was 169. So he's lost about 7% of his body weight in 1 month and 16% in 2 months. So his current BMI, even though he's considered malnourished, it is normal. It's 19.81. Currently, his sodium and potassium, phosphorus, those are okay. His glucose is a little on the low side. I think the 69 was at a point when he hadn't eaten when he had woken up. His liver function is elevated, and his hemoglobin and hematocrit have seen a decrease since admission. His inpatient medical course relevant to nutrition. Over the last 24 hours, he's not letting his output be measured, but his intake has been about a little over 2 liters. Again, he is receiving systemic chemotherapy, and prior to discharge, he's going to have follow-up MRIs and CT scans just to assess the cancer status. Past medical history, he does have a history of tobacco abuse, constipation, cellulitis of the left groin, and hemoptysis. His current medications include etoposide and cisplatin, which he's going to receive for all 5 days. And he will also receive 1 more dose of bleomycin, which all 3 of those are chemotherapy medications. Currently, he's receiving normal saline at 100 mLs an hour, but I believe this is a bolus. Zofran 4 milligrams IV a day, as needed for nausea, and then dexamethasone 4 milligrams twice a day. His skin status right now is intact, with no pressure ulcers or wounds. His estimated nutritional needs are based on his current weight. He does require additional calories and protein because of his current diagnosis and treatment for the cancer. So his calories should be 30 to 35 kcal per kilogram per day, which equals to 1,950 to 2,275 calories per day, or his protein 1.5 to 0 grams per kilogram per day, or 98 to 130 grams total for the day. His fluids should match his calories ideally. He should be receiving about 1,950 to 2,275 mLs per day. His current diagnosis is inadequate energy intake related to physiologic condition preventing adequate oral nutrition, which would be the nausea and vomiting related to his cancer treatment, as evidenced by weight loss of 16% in 2 months, patient report of poor intake for the past 1 month or more. For his intervention, under food and nutrient delivery, we wanted to modify the distribution type or amount of food and nutrients within meals or at specified times. So we recommended that he order alternative meals if whatever was being offered that day was not appealing to him, so that we could encourage better intake. We also offered liberal diet ordering, so we let him order as many food choices as he wanted. And then when he's not nauseous, he was allowed to request snacks and beverages. For monitoring and evaluation, his indication marker was the intake of his meals, so the percentage, and then the criteria or the SMART goal specific to that marker is that he would consume at least 50% of all ordered meals.